I'm JB Wogan from Mathematica, and welcome to a special video episode of On the Evidence, the Mathematica podcast. My guests today are Ravi Goyal and Natasha Martin. Ravi is a senior statistician at Mathematica who has expertise in epidemic modeling. Natasha is an infectious disease economic modeler and an associate professor in the Division of Infectious Diseases and Global Public Health at the University of California, San Diego. Welcome, Ravi and Natasha.
Thank
Thanks
you.
for having us.
So I understand that you all recently collaborated on a project that predicted the spread of COVID-19 at the University of California, San Diego under a range of scenarios. In particular, the model tried to assess the impact of mask wearing, social distancing, different frequencies of asymptomatic testing. And I know that's a very simplistic, high-level summary of what you all did, but I hope that we can tease out some of the nuances in this episode's conversation. So, Ravi and Natasha, I wanted to start by talking about the beginning, the start, the origin story of how you all started to work together on the topic of campus reopening decisions amid a pandemic. And Natasha, I should say that I know that part of this work is related to the university's Return to Learn program. So perhaps you can give some background about what the Return to Learn program is as well.
Sure. So, it was back in April. We were already thinking about if we were in the position to resume some amount of on-campus activities in the fall, how might we do that in the safest way? And I was speaking to a colleague of mine, Professor Chip Schooley. He's a professor of virology here at UC San Diego. And he and I were chatting about how we really wanted to have a data-driven, science-driven approach in terms of how we could reopen things in the safest way possible. And as part of that sort of data-driven approach, we thought, okay, well, we would want it to have a very strong foundation, both in the science, but also in quantitative analyses, if possible. So originally, we were thinking about the three main pillars that we would want to have as part of this approach, this Return to Learn program, as you mentioned. And the three pillars are risk mitigation. So that incorporates things like masking, sanitation, but also structural things that we could do on campus, such as changing the density of on-campus housing from triples to singles to doubles, for example, and changing the way that we provide classroom instruction. So having hybrid classes, classes online, limiting a maximum number of people that could be in a class. And actually, a lot of those decisions we could look at within a quantitative framework using the modeling approach that Ravi developed to help us understand the relative benefits of decisions such as density as well as classroom strategies. And the second pillar is viral detection. And so that incorporates our asymptomatic and symptomatic testing programs, as well as our wastewater monitoring program. Again, things that we could look at quantitatively through Ravi's models to try to understand the relative benefits of different testing frequencies, for example. And then the third pillar was public health intervention. So that's your case investigation, isolation of individuals who are sick, removing them so that they can't transmit to other people, as well as quarantining individuals who have been exposed to ensure that if they are infected, they don't transmit to others. Again, yet another thing that you can put into Ravi's really complex models to try to understand how all of these three pillars can kind of work interdependently, how they can all work together synergistically to keep campus safe, and the relative benefits of different strategies at different time points of the epidemic. So when we had this sort of conceptualization of these three pillars and what the Return to Learn program might look like, that's when I had actually developed some very simplistic models that didn't really incorporate the nuance of campus interactions and campus housing. But with these very simple models, try to take a first step in terms of thinking about how much testing might we need, what's the testing volume. But I quickly realized that what we really needed was something much more sophisticated that was able to account for these complex networks that we have on campus and the different ways that students, faculty, and staff interact. At that point, I approached a colleague of mine, Professor Victor de Grotola. He's a biostatistician, both at Harvard and UC San Diego. And he's worked with Ravi for many years, and he immediately said, I have the person that you need. Let's link these teams together. Let's put our heads together and think about how we can develop the right model to, again, really provide some kind of quantitative insights into the decisions we are making.
All right, fantastic. And Ravi, Natasha has sung your praises already in her answer, but I just wanted to know, is there anything else that you want to say about the specific role that Mathematica could play in supporting that return to learn program?
Yeah, I think it was a great pairing of people on the project. So I think some of the expertise, not only what I brought in, but also some of the other colleagues here at Mathematica, worked very closely with John Hodgkiss, who's very good with developing code. And especially when you think about these models, they're very computationally burdensome. And so working with a lot of different technologies to make sure that they run in a finite amount of time. But also, thank you, Natasha, for all those kind words. And I can equally say all of it back to Natasha and to Victor and Chip. And it was just a wonderful team. So I think in my mind, I think Mathematica brought some skill sets, but also I think it was just a wonderful team to be a part of. And I think it just sort of, as Natasha said, just sort of all the pieces sort of aligned very nicely.
And to your point, Ravi, I think one of the things that we were able to leverage was that we had the amazing quantitative skills and quantitative engine that Mathematica had developed. And we had the detailed data that was needed to really parameterize and refine these models, down to the level of how many individuals in a room and how many bathrooms do they share and how many, across all the different residential buildings on campus, and how did each of the classroom registration looks in terms of class sizes and numbers. We had data back from the year. So we had a huge amount of data that we could use to inform these very detailed, sophisticated models of all these interconnected networks, and being able to actually ingest that and integrate that into a model that could then simulate COVID transmission on campus was just really an exciting thing to be able to do with the data that we have and the quantitative skills that you provided.
So Natasha, I imagine some of our listeners and viewers may not be that familiar with the University of California, San Diego. So I was hoping you could give just a little thumbnail sketch, how big is the university, how many students, ballpark, number of students who go there, and in non-pandemic times, would you expect a lot of them to be living on campus?
Yeah, we have about, including students, faculty, and staff, we have about 60,000 people that are part of our UC San Diego community. At the moment, we have about 9,000 students who are resident on campus, even though we've reduced the density of students that we welcomed back to campus this year. But we also have about 18,000 students that live off campus in the San Diego area at the moment. So we have a very large campus population that interact with, again, faculty and staff. And we realized very, very early on that, these populations we're not an island and they're not in isolation, right? So we knew that much of our campus community, even during the pandemic, would be residing in the community, living in the community, and exposed to the virus. And as much as we could do to try to keep everybody in a bubble, we knew that wasn't going to happen. We would have viral introductions on campus. And so that's what really motivated the focus on, given that we expect and anticipate kind of continued viral introduction with this relatively large number of students, both residing to campus as well as coming onto campus for in-person classes, how can we best reduce the risk associated with those interactions and be able to provide some amount of educational as well as research activity in the background of the COVID pandemic.
Ravi, I understand that the University and Mathematica settled on using agent-based modeling to understand the risks involved with reopening the campus under different scenarios. Let's pause for a second for some emergency glossary time. What is agent-based modeling, and what does a layperson need to know about this particular type of analysis?
Yeah, agent-based modeling is a computational approach to simulate the actions and interactions among individuals in a population. And so when you're thinking about infectious diseases or anything that, transmits from one person to another, whether it is a disease or a virus or rumors, for example, it's very important to sort of understand what are those interactions that people have. And agent-based modeling provides this framework to be able to explicitly model these interactions. And so I think this is what sort of differentiates it maybe from some other computational approaches.
Okay.
And as Natasha was saying, and that is very important when we're thinking about, and as Natasha sort of said, that there's a lot of different interactions. There's interactions between students themselves in the classroom or dorms, as well as between students and faculty and staff. And each one of those carry different kinds of risks. And it's important to sort of capture that when you're thinking about different mitigation strategies.
Okay. All right, gotcha. So in addition to the kind of raw analysis that you did for the university, you also, or Mathematica, collaborated with the university to create a public-facing web tool. And I was browsing this web tool a little bit today. It's available on Mathematica's site. And it looked like the model predicts that higher adherence to mask wearing and social distancing would reduce disease spread, as does a higher frequency of asymptomatic testing. And that is, I guess, for people who might not know what asymptomatic testing is, from my understanding, it would be regular testing of people who may not be presenting symptoms but could still be carrying the virus. Ravi, Natasha, is there anything else that you would want to highlight in terms of trends or major takeaways from the model and what it showed?
Yeah, definitely. So I think that we used the website to convey the two most important things that we wanted people to understand. For the students, we needed them to know that their behavior in terms of adherence to masking and social distancing was critical to the success of the entire approach. We can do as much risk mitigation as possible, but if people, don't wear a mask, don't socially distance, then everything would fall apart. So that, I think, being able to show that and illustrate that was very important in terms of the web tool. Testing, as you mentioned, one of the insidious things about COVID-19 is that you can be infectious prior to developing symptoms, or you may not develop symptoms at all. And so in order to really break those chains of infections, we need to be able to test and identify individuals in that asymptomatic period. And that's in getting people to participate in our asymptomatic testing program is very important to us. So again, an important message that we wanted to convey on the website. There are some simulations, many simulations, in fact, that Ravi's team did that aren't shown on the website that did help inform decisions that were made on campus. So for example, one of the early decisions we were thinking about was how, if we bring residential students back, what kind of density housing should we provide? And normally, or last year, we would have individuals in singles, doubles, as well as triples. Ravi looked at a range of scenarios in the model with different combinations. In the end, we decided only to bring students back in single accommodation this year. And so that was something where the modeling indicated that, it was much more beneficial to have students in singles, for example, compared to doubles housing. Another decision that the model helped us understand and inform was, as I mentioned, classroom instruction. So Ravi's model looked at whether how much benefit and how much relative benefit we would have in terms of reducing outbreak sizes if we shifted some of our classes online, as well as the impact of different classroom caps. So if we capped the maximum classroom size at 100 or 50, for example. In the end, we had hybrid instruction, no classes over 50. Again, these decisions all made with the information that Ravi's model provided in terms of the relative benefits of the different options.
Ravi, is there anything else that you would want to tease out? For instance, one thing I noticed was in our news release on the Mathematica site, one of the takeaways that was highlighted was that if you had to choose between testing that was highly sensitive and accurate, but maybe you were doing less often, versus highly frequent testing that was a little less sensitive, that you would actually be better off doing the more frequent testing that was less accurate. Am I characterizing that correctly?
No, that is correct. That was one of the takeaways that we sort of saw when we looked at different frequency and different sensitivity and specificity of tests, was that catching people earlier on, or getting a higher percentage of people who are carrying the virus earlier, just seems to help mitigate the overall spread, rather than being overly sensitive. But there is a potentially downside of having maybe tests with slightly poor performance, is that you may end up, especially if they are not carrying the virus, but the test is returning positive, you may end up spending some resources on contact tracing, as well as quarantining and isolating individuals.
Yeah, no, I think that was a really important kind of generalizable conclusion that is applicable not just to UC San Diego, but any place looking at a testing program, that if there are tests that are available that are maybe slightly less sensitive, for example, antigen testing, but they're easier to either administer, people are more willing to take them. They're cheap if they are cheaper, and you can test more frequently. The benefits of being able to test more frequently and get higher uptake far outweigh the small individual loss in test sensitivity for an individual person when you're looking at this population prevention benefits of being able to identify somebody and then prevent transmission at a population level. And I think that's a really kind of important message that is important in the broader community, not just specific to our university.
All right, so Ravi, I have a question for you. I have to assume that creating the public-facing tool was not really necessary for providing the immediate data and findings to the university. So I was wondering what led you to also go that next step of creating something that the public could interact with and use, and maybe how did you hope that this would be used? Who was your intended audience, and and just to tell me a little bit more about what your intentions were with this web tool that viewers can find and play with online.
Yeah, I think so. The goal was always trying to provide that information out to the broader college population, as well as to the general public. And I think there was a couple of things that, as we were going through the analysis and understanding the model, but also seeing how the pandemic was playing out in different settings, and what were maybe some of the areas that ended up being maybe an area that universities need to focus on. And Natasha already touched upon that. One is really we started seeing that behavior and masking, especially going late summer into the fall, beginning of fall, that was just going to be a very important thing, is social distancing and masking on a college campus, but generally in the public. That's going to be very important. And we wanted, when we were all sort of talking, we wanted to sort of be able to convey that in a visual format, as well as the second point on looking at understanding testing. And I think, and Natasha may be able to speak a little bit more to this, but I think there was sort of this 2 points I wanted to get across to the general college campus. Is one, that the university can do a lot in terms of classroom and de-identification and testing, but then also the community also has a part to play in making sure that everyone is safe. And so I think those two sides we sort of thought about how we can convey those two sides.
Yeah, I think that's absolutely right. I mean, the only thing I would add is like Ravi mentioned, we did see early on for the universities that were on semesters that brought students back kind of in August, a bit earlier than we did. Some of those, unfortunately, had very large outbreaks very early on. We saw that they were, not associated with classroom instruction. They were people socializing off campus in parties and in big groups unmasked. And so we realized that that was a very big risk. And we did want to be able to use this model to also help people understand that potential risk. And the really unique thing about Ravi's models compared to many, if not most of the models that were published at the time, which were compartmental models that don't incorporate these very complex networks of how individuals interact in their houses or in their social networks. Because Ravi's model had that sophistication, it was able to look at clusters of outbreaks and connected individuals and how big those clusters could grow. And I think that was a very important concept because that was what we were seeing on campus. We could see one or a few individuals, at a party rapidly contributing to growing clusters. And we really wanted that visual as well as that message to resonate with the students so that they understood their responsibility. In addition to the students who were, by the way, hungry for seeing the model, they were very interested in, as I mentioned, this data-driven approach, and they wanted to know more about it. They wanted to see what the model looked like. They wanted to get their hands on it to be able to play with the assumptions themselves. And they were asking for it. But I also think that it was the web tool is another way for us to show and showcase this sort of general adaptive approach that we're taking to our response on campus. That, the model that we've had has been revised several times, and we'll revise our assumptions as we go, as the epidemic changes, that those revisions can be put online as well, so people can see how we're kind of continuously incorporating information and adapting to the situation and adapting our assumptions as we go and as we move through this pandemic. So I think it's a really nice way of being able to be very transparent about that.
When I was browsing the tool today, I think I noticed, so you actually present estimates on the number of infections both on campus and in the community at large. Is that right? That there's sort of a bifurcation there so that you can see the on-campus transmissions that are being controlled by decisions and strategies on campus, and then the transmissions that are outside of your control but will likely still occur.
That's right. Yeah. Oh, I was hoping that you were about to ask me how well did we perform now that the term has ended, and I was going to say we wildly outperformed our expectations in terms of looking at those on-campus transmissions. But yeah, no, the great thing about the model is that, we were able to look at it to see, okay, what is the relative impact of our strategies, both in terms of reducing potential transmission that occurs on campus, but also highlighting that there's this large chunk of it that we don't have control over. That is people that are exposed to the virus in the community getting infected and bringing it onto campus. And in fact, what we saw over the term is that the vast majority of infections occurred on campus, and we only had very few transmissions that occurred within, for example, roommates within a special room. We had no transmissions that we could identify were associated with classroom or research activities at all. So in that sense, I think we were very happy to see that. But it's a really important reminder as we move forward and refine our assumptions and revise them that again, we're not insulated from the broader community. We're right now in a period in Southern California and in San Diego where we have a very high amount of community transmission, which we expect to increase as we move through the new year and the holidays. And that we expect that as we bring students back for winter term, that we'll see that coming back onto campus. So again, I think we were happy with what we saw in the fall, but we're keeping the same things in mind in terms of how we approach this new term, thinking that there will still be this continued import of infections, which Ravi's model so beautifully illustrates.
Okay. And Natasha, I know that you've already referenced some of the ways that the model had informed decisions on campus, but is there anything else that you would like to point to? I mean, I'm kind of curious. I know this isn't the only evidence or the only thing that you're considering, that the university is considering when it's making decisions about how to reopen, how to try and prioritize safety, but also continue education in person. So yeah, how did it flow into those other pieces of information that were used to make decisions?
So we're continually innovating and we're continually adapting our approach on campus, and then we have to kind of adapt the modeling accordingly. But one of the things that I haven't gotten a chance to mention yet, which has been really instrumental to our response this fall, is our wastewater monitoring program. So one of the first things that actually came out of Ravi's model was that if you look at the average outbreak size predicted from the model, it was quite low, just a few, maybe 2 or 3 clusters of infections linked to each individual viral introduction. But if you look at that distribution, some of those, on the tail, there could be a single outbreak that could be very, very large before it was detected. And in Ravi's simulations, those single kind of large outbreaks that occurred, not very frequently, but could occur just by chance, tended to be associated with residential buildings on campus where there were a large number of students residing in that building, or very large suites where they were sharing a lot of roommates within that building. So one of the first things that we did when we were thinking about wastewater monitoring was trying to prevent the risks associated with that. So wastewater monitoring, we can actually collect the wastewater that comes out of one or a couple cluster of buildings, and we can test that wastewater for SARS-CoV-2. And if it's positive, then it indicates that there may be one or more individuals that are infected and shedding virus in their stool in one of those associated residential buildings. So it's kind of a version of pooled testing, right? We can test every day. The wastewater is collected we have these automatic robots that sit on manholes in the sewers, and they collect little samples once every hour. And then we collect that sample once a day, that composite sample, every day, and we can run that test. So every day we can essentially run a version of pooled testing on all the residents associated with that building. If the wastewater is positive, then we can put out alert to the residents of the building and say, please, we have a positive wastewater signal, please go get tested at our free asymptomatic testing program, and hopefully we can find the infected individual and isolate them and prevent them from transmitting. And the very first thing we did when we got those first few samplers was put them in the buildings that Ravi's model were predicting were associated with potentially very high outbreak sizes if undetected. So we did that. We expanded now. We started with 6 wastewater samplers. We now have near 100 wastewater samplers, and we're expanding to 200 this term, which will basically blanket the entire campus. And again, now we're going back and we're saying, okay, well, we need to try to understand and incorporate into Ravi's model the impact of this wastewater monitoring layer and how that's working together with all the other things we're doing on campus. But it's a nice way that some of the initial quantitative insights from the modeling informed what we did in terms of our campus response.
Ravi, I know this tool was made specifically for the University of California, San Diego, but I'm sure people will wonder about its applicability in other higher education contexts. So if I'm a university president somewhere else, in another part of the country or another part of California, or maybe I'm just a parent of a student at a university somewhere, how should I use the tool? And what would you say are some important caveats or qualifiers that we should underscore in this conversation?
Yeah, I think in terms of other universities, so yeah, once again, like Natasha sort of mentioned, what really made this model particularly, really fitting is all of the data that the housing department and the registrar department brought to the table, and that level of specificity that we were able to incorporate and really model the particular UC San Diego population. But I think some of the insights and finding are applicable across the board in many different settings, and in particular, many different university settings in terms of things that we see in testing. And I think some of the findings about masking and social behavior is going to resonate. The specific optimization of different protocols may differ depending on the housing structure, depending on the size of the dorms that different universities may or may not have, and probably the proportion of people who live on or off campus. Some smaller, maybe liberal arts schools can have most students on campus, in which case you might have a very different dynamic in terms of having this infection coming from off campus versus what you might see in a more at UC San Diego, where it's a little bit more potentially integrated with the community. Some of the caveats, I will say there are probably a number of caveats that one wants to mention when looking at these models. The first one I'll just sort of say is there at the time of the modeling, and I think it's still true now, there's a lot of unknowns about transmissions and different settings in terms of, for example, in closed classrooms, how is the ventilation? How is that going to spread from person to person? So there's a lot of different maybe caveats or considerations that still have to sort of scientifically be worked out. And the other caveat is, which models struggle with, is human behavior. And are they going to adhere to the protocols of isolation and quarantining? And it seems like UC San Diego did a great job on conveying that message and getting the community on board. But Natasha, I know you live on this day to day. I don't know, I find human behavior very tricky and how to sort of capture that and get that to actually, from what you ideally want in a model, to actually having that in the real world is.
Yeah, I think Ravi makes a great point, and that is that, well, first of all, the model can't predict exactly how many people are going to be infected, in 96 days time. But it was very useful for trying to understand the relative benefits of different approaches, which I think is really fairly generalizable across most university settings. But having said that, the other thing that was very important because we cannot predict human behavior, and there are unknowns in the future, and is it helped us understand what kind of data we might want to collect in order to understand these things better, right? So when the model was showing us that it was fairly sensitive to specific assumptions about, for example, masking or numerous other kind of the technical assumptions we put into the model, it helped us create a list of the data points that we wanted to collect so that we could monitor what was happening over time and then refine those assumptions as we went along, and also monitor those metrics, which we could see as being influential and important in terms of those trends to see if they were changing over time. And so again, I think that this is another example of, the models are not crystal balls. They can't tell us everything, but they can tell us relative benefits of things, and they can also tell us what we need to pay close attention to and what data we need to collect in the future to refine our assumptions as we go. And then, back to that iterative process, we collect data, we refine the model, we generate new projections, and that sort of continues and brings us to a point of greater and greater certainty as we move through this epidemic together.
Okay, so I want to finish the conversation by looking a little bit to the future, and both of you have done a nice job of actually already teasing or previewing a little bit of what's to come for both of you. But as we record this conversation, Americans are starting to receive vaccinations, but we're also seeing cases increasing at an alarming rate. So, Natasha, besides the agent-based modeling tool, what else is the university working on to respond to and manage the COVID-19 crisis?
Yeah, so we're absolutely thinking already about vaccination strategies, and I know Ravi's model is being adapted to look at that, so I'll let him talk about that. But, we are a bit away from that, especially for the young university populations, and so we are still staying, very focused on what the here and now, what we're seeing right now in terms of the potential surge of cases coming out of this winter break and how to manage that as best as we can coming into the spring. And just thinking about, again, how do we stay one step ahead of this virus at a time where it's taxing both our hospitals as well as our communities, and thinking about how we can both address the virus on campus, but also use what we've learned and what Ravi and I have learned in this quantitative process to inform the broader community's reopening. So in this interim period between now and, I don't know, the summer where we have expanded vaccination, there's still going to be questions about, do we reopen schools? How much do we reopen them? What segments of the economy do we reopen? How do we reopen things safely? And I think this just general quantitative data-driven approach and modeling can help, serve as a model for all of that. And that's what I'm hoping that we continue to do in this period that we're in right now until the vaccine hopefully, gives us the herd immunity that everybody's waiting for.
All right, Ravi. So Natasha already teed you up a little bit about vaccinations. I was just going to ask you, what's next for you in terms of your work related to COVID-19? Are there more potential applications for agent-based modeling? And do you have any other projects in the works that people might be hearing more about in 2021?
Yeah, so I think there are a number of different offshoots. I think vaccinations and sort of thinking about that role, and especially at the younger populations of either colleges or in K through 12 is another area that we're sort of thinking about, because they will be on the later end of receiving these vaccinations. And I think in terms of the university work, I think, besides looking at vaccination, sort of looking back maybe a little bit on different data points that would have been really useful to inform the model, as well as thinking, kind of a little bit forward, is what are the pieces, things that we want to learn, things that we want to sort of make sure that we can adapt and be better prepared always in the future, and maybe be a couple of steps ahead next time around. But other things that we are looking at is in K through 12 as well, and understanding maybe some of the role of testing as more and more schools are going to be hopefully opening up in the spring, and that's going to be around the corner. And once again, they'll probably be on the later end of the vaccination. But education is very important at the K through 12 as well as the university, and ensuring as much of that can happen in 2021.
And with regards to K through 12 education, we should say that you've already worked with the state of Pennsylvania to use agent-based modeling to predict the spread of COVID-19 in a K through 12 setting, and that people can go onto Mathematica's site and see what the findings of that work was. But there's already some work to be shared in that regard.
That's right. We and that would work with Brian Gill, and so we have done some around K through 12, and we'll be continuing that additional work with the Rockefeller Foundation in terms of specifically around the question of testing.
Okay. All right. Great. Well, the standard last question I always like to ask in interviews is, what did I forget to ask? What is there that you would like to talk about? Anything we should have covered that we haven't yet?
I think so. One thing I only got a glimpse of this being an outsider on the UC San Diego sort of process on how, getting some of the glimpse on how they rolled it out, and in particular around the modeling. And what I do want to say is how collaborative it was. And when we were talking about, the student enrollment, one thing I did want to sort of mention is that the student present was, at least the meetings that I was at, was also there. And I had no idea, like, that she was a student. She spoke and everyone listened. I thought it was a fantastic environment. And I, my own gut feeling is that contributed to the great success that the university had, is because everyone's voice was at the table, and it seemed like everyone's voice was heard. And I thought that was just a fantastic, being an outsider, seeing that sort of unfold and how that process is, was very interesting.
Ravi, I think that's a great point to basically just acknowledge that this work was really enabled by a huge number of people, and the whole Return to Learn program. I mean, we can't even list everyone who's been involved in it, and we'd inevitably forget, but I think one thing that I would love to emphasize that it was illustrative in our small modeling project, as well as the whole kind of return to learn program, is that it was very grassroots, that it was actually, the faculty and the researchers and the students coming together, thinking about what we wanted, what everybody's priorities were, and bringing suggestions to the table and having the senior leadership really consider those and grasp onto our ideas and suggestions and run with them. It wasn't top driven and sort of, in that sense. They were very open to hearing our suggestions and facilitating the ideas that we had from the wastewater monitoring program to thinking about how we might deliver classroom instruction differently. And I think that the modeling was one illustrative example of that, of everyone, being so willing to provide data, share data, and think about how we could tailor the model even closer to the UCSD community. And it was really exciting to have that amount of engagement in both the model building process as well as the sharing of the results at the back end of it. And I think it's a better product for it, as Ravi mentioned, that we were able to engage so many people along the way.
All right, fantastic. Well, Natasha, Ravi, thank you so much for talking with me today. I look forward to following your work in 2021, and hopefully we'll put this pandemic in the rearview mirror sooner than later.
Thanks so much for having us. It was nice to chat.
Thank you.